All right. Well, welcome everybody to the Clinical Consultation Network. This is Bruce Davis. I am the Deputy Commissioner of Clinical Services for the Department of Intellectual and Developmental Disabilities. And I have a guest today that I think everyone is going to be very happy to hear from. Her name is Janice White. She's an Incident Support Coordinator from Clarksville, Tennessee. She's going to talk to us about a woman that she's worked with for some years and who has had some success in the system. And so, we'd like to learn from these successes, and Janice is going to talk to us all about that in just a few minutes. Also, my co-host today is going to be Michelle Bagby. So, Michelle, why don't you say hello to everybody?
Hello, everyone.
So it's very good to have Michelle here, and so we'll tag team with Janice here in a few minutes. Before we get into that, though, I want to make a couple announcements. I guess this will be the final time that I get to make the announcement about the upcoming TNMED conference, because it's this week. So I hope that everybody has signed up already. If you have not signed up already, go to the TNMED website and find out more about the conference and sign up. The name of the conference this year is Making the House a Home, Empowering Independence. We have a number of really great presentations that are going to be going on there. We have Dr. Thane Dykstra, who will be there talking about how to deal with people who are having different sorts of behavioral challenges. We're going to have several presentations there about the use of technology, including telehealth, to support people. And this is telehealth is a real burgeoning thing at this point. I think it is something that can be helpful to people with intellectual and developmental disabilities. One of the things that it's really helpful for is reducing ER visits. So a lot of times people are having to go to the emergency room for just basic care that they can get through telehealth. And so it really it makes life a lot better for those folks. And it's also having some application for evaluation of mental health concerns and other things of that nature. So I highly encourage you to come to the conference, find out more about what we have going on. The response this year has been tremendous. I mean, you would not, I suppose you would believe how many we have. I think we had at last count 117, 118 people that were signed up for the conference. That's going to be our best attended conference I think that we've ever had. So the interest in TNMED is growing. For those of you who may not know, NAD stands for the National Association for Dual Diagnosis. So we're the Tennessee chapter of the National Association for Dual Diagnosis, and we just try to put on a very good conference every year, and something that I think if you're part of the Clinical Consultation Network, you want to be part of this organization. So I encourage you to go to the website, find out more about what we have to offer, and to get signed up for this conference. That's tn-nad.org. I'll also tell you that somebody want to jump in and ask a question?
Yes, I did. I haven't been able to find out what time we're supposed to be there. What time do we need to be there?
So I believe I'm correct to say that the conference starts at 8 o'clock, but let me double check myself because I do not want to misspeak. So registration, can you see my screen right now?
Yeah. Okay, I'm looking.
So it should be giving you a conference agenda. Can you see that? Thursday, August 22nd. So the whole schedule. Are you seeing that?
Actually, I am not. I don't have the WebEx link on this.
Okay.
On this invite.
For those who do, you can see this. If you don't, you'll be welcomed by John Weston, the president of TNMED. It starts at 8 o'clock. Brad Turner, our commissioner from DIDD, is going to be there. He's going to speak, do an opening statement as well, and then we get right into the conference from there. So, and I haven't really mentioned much about this presentation and some of the discussion that I've had, but Eric Folk is coming to us from Hawaii, and he's going to talk about the keys to self-determination. Really important topic from the clinical perspective. I think about this all the time because if we're working with people from a clinical perspective and not trying to give them control of their lives, then we're really working at cross purposes. with what we should be hoping to accomplish. So I think that's going to be a really interesting plenary address that we have. And as I mentioned, Thane Dykstra is going to be there talking about the title of his address is How to Win Friends and Influence People, ... with challenging behaviors. So that's I'm not going to say that's what we're all about, but that's a lot of what we're about sometimes. So I think this is just a well put together conference that everyone will enjoy. So please check it out. All right. So with us today is Janice White, one of my old friends. I don't know, Janice, how long have we known one another? Probably.
It's about 1988, 89, 90.
Well, it might have been, I came here in 95, and I think we've known one another since then. Probably you were one of the first people I met when I came to Tennessee, and so I'm really glad to have you on here today and to be able to find out a little bit more about you, and also to find out about this case that you've been working with. So, Janice, just start us off with a little bit of a background on yourself. Where did you come from?
I came from Kentucky, not too far from on the other side of Hopkinsville. And
you came from Kentucky, so you are one of the people that would admit coming from Kentucky.
I am. Very proud of it.
Well, sure, of course. The Bluegrass State. So you came from Kentucky and moved to Tennessee, and tell us a little bit more about how you got into working with people with disabilities.
Well, I graduated in 1969, and I had an aunt who was working at, it was then called Outwood Hospital and School for people with mental retardation. And I had volunteered when I was in high school, and she was a nurse there. And so that's where I went to work. And I was lucky enough right at that time is when people started to think about coming out of the medical model and treating people a little differently. They served children as well. There was not even a playground on their grounds. And so I was in the very first program there and received some special training in what they call behavior modification then. And we were given 20 little girls and 20 little boys to work with for 1 year to see how quickly it would take us to fail.
How old were they?
They were from 6 to 20.
Okay.
And so there was actually a designated area. We wore street clothes rather than nursing uniforms. We built playgrounds, and of the 40 children in the first year, all but one.
Yeah, we hear you. And so, yeah, we're launching right on through. I think you're with us. Go ahead, Janice.
All but one was toilet trained, and they were all eating with a spoon, which had not even been an expectation before.
Wow.
And so from that experience, I went to work there and worked for about 4 years. And then I went to school and was going to do anything but work in this field. I was pretty burnt out at that point. But anyway, a few years later, in 1987, I came to Clarksville, newly divorced, looking for a job, and went to work for Progressive Directions here in Clarksville. I worked for PDI in various positions, started out direct care and ended up in administration, and worked there until 1997 when I got a memo about support coordination came across my desk, and I applied, and I've been a support coordinator ever since.
Okay. Well, yeah, I remember. That's where I remember meeting you, and I remember that was, that was in the early days of my being here. And at the regional office, we had myself and Celeste Yance at the time. She's now Celeste Roberts. Roberts, by the way. And so we would go around to all the agencies and provide some consultation, and so that's how I got to know you, was up at Progressive Directions. So very good. So now you've got a case that you've been working with and that you have had some success with, it sounds like. So why don't you just kind of launch in and give us a little bit of background information on the case, and then we'll discuss it, okay?
All righty. Well, Jane is 46 years old. She's been in service since she was 22. She lived at home and had personal assistance services for a few years, and sometimes they were effective and sometimes they were not. Anyway, because she was living with her grandparents, she ultimately went into supported living. And her history was sort of that she would do well for a while and then everything would seem to fall apart. And a lot of it depended on, I believe, trust. If she did not trust the people she was working around, she would exhibit pretty negative behaviors. And so what happened is she ended up going from supported living placement to supported living placement.
All right, so let me clarify something about what you said there. So she was living with her grandparents, and there was was there a point at which that wasn't working anymore, where she was not able to continue living? What was the breakdown there? How did she end up leaving their home?
During high school, her grandparents really treated her fairly normally. She was in special education classes, but she also participated in basketball, and she was a cheerleader for a while, and that sort of thing. Once she graduated, that continued, and she began to date and that thing. And sometimes they were, people not from here, soldiers and that sort of thing. And she ended up having some pretty negative experiences involved in drug use, not coming home. There was a pregnancy. The child died at birth. But I think grandparents just felt like they did not know what to do for her. And she was, when was she first diagnosed with intellectual disability? Was it, during childhood, or was it later during her adolescence? It was during, I don't know exactly where along the way, but I do know that at least in high school, she was in special education.
Okay.
She does read. She can do basic math. She has a lot of skills.
But she was identified as a person with intellectual disability even while she was doing lots of things. It sounds like she was involved in lots of activities and very socially connected when she was in high school.
She was, yeah.
Yeah. Okay, it's interesting. And then, so she was vulnerable, though, when she grew to be an adult and began to date people and other things of this nature. Do you feel like she was taken advantage of some during that period?
Absolutely. A lot during that period.
Okay. So now I think I've caught up to where you are. I just want to I always like to check in, make sure I've got the story clear as we move forward. So go ahead and pick up there and tell us more about it.
Once she went into supported living, often Tamika knew about it. I'm so sorry, Jane knew about I'm sorry,
You're
as
okay.
much about the program as most people did. And so if people were doing things that she did not see to be right, she did not hesitate to let them know, and much of the time not in the most socially appropriate way. She had difficulty sometimes getting along with her housemates, and so I really am not even sure how many placements she had. Several in Clarksville and at least 3 or 4 in Nashville.
Okay, so she was moving from place to place. And diagnostically, what diagnoses was she given at this time, or was she given any diagnosis, or like was there anything? Yeah.
She was diagnosed with a mild intellectual disability, bipolar disease, and PTSD from some pretty rough experiences during the time with the drugs and the pregnancy and that sort of thing.
So post-traumatic stress disorder, trauma, essentially, was a big part of the picture at this point.
Yeah.
All right. So that helps me kind of understand where we are. Go ahead and proceed from there.
I will also say, while I have not worked with her directly for many years, she's been on my team. And so I have heard from her a lot. And I do know at one point she had gone back to Progressive Directions. This is probably about 10 years ago. And she had been in Nashville, and I'm not sure really what happened there, but she was acting as the receptionist at TDI, and she was so over-medicated, she could barely hold her head up.
Mm.
Yeah, and then she did get support in coming off of most of that medication, and so that didn't help at all either, because she lost that job and a few others during that period as well. And sort of what happens when she goes to work is, at first there will be a wonderful honeymoon area, because she's very kind, she's thoughtful, she's funny, everything that would attract a person to someone, very willing to work, but then somewhere along the line that changes. I don't know why, but it seems to change, and then it is not such a wonderful relationship.
How long of a time frame is that for her? Like, how long does it go well?
Her last job, she worked at the commissary in Fort Campbell, and she was there about 8 months. The first
so things have been going well for the first 7. Okay, you're right. Explain.
Very. In fact, as they were wanting to withdraw all supervision, and I sort of intervened in that and asked them not to do that, knowing that she would not do as well, and it took about 3 weeks. The circle support made the decision that they should withdraw support, because having support put a spotlight on her, even if they were just observing it, still was not a good thing.
Well, and so if I was going to question what you were saying with the trust, because it seems like if you're there for that length of time, your trust for the people there would increase rather than decrease, unless, of course, something kind of intrudes and something happens that causes that trust to be broken. But what you're saying is that she had someone there with her. She had a job coach. Right? Am I understanding it correctly?
Yes, she did have a job coach. They had withdrawn pretty far away from her. They did not work directly with her, but they checked in with her several times during her shift. But I will say this, her family model situation was also falling apart during that time. And they were, the family model said that she, was refusing to get up and go to work. She and her family said that was not true, that they did not want to provide transportation for her. I'm not sure exactly what happened because that placement did not last very long after that either.
Okay, so you had basically a couple of things happen at the same time, and it may be a little bit hard to sort out exactly what caused what. But I can see a scenario where even if I think that speaks a little bit to how much the trust factor plays such a large role, potentially, may explain that. Because, the thing is that you can trust can be emanated by just a very small change in the environment. And so in this circumstance, the job coach was pretty much completely, almost entirely faded out of the scenario. But when it went the final step to that person not being there anymore, potentially that's at least one hypothesis you have about why the job fell apart at that time. And then, adding to that things were going on at home. And I guess it probably, the other part of a fading program like that has to be not just fading yourself out, but maybe fading someone else in those circumstances to make it work well. So just a little bit of food for thought there as people are thinking about different ways of fading different things. I get asked questions about that all the time, and I think that is a large reason that sometimes we find ourselves unsuccessful with those is because maybe it has to be broken down, kind of played a little bit different. But I'm interested to see how that affects the rest of your story. So I'll let you pick up from there and continue.
Well, at that time, she was fired because she missed 3 days at various times without calling her supervisor. Or at least that was the reason given. I think there probably was more to that. I know at one point a staff member got into a verbal altercation with her supervisor. And that is probably when all trust in that person, not the supervisor, but the sort of went away. And I will say from all my observations of her, trust and family are the two most important things in her life. And if you don't have trust with her, you're not going to be very successful.
All right, so we'll get into that a little bit more in just a minute. The one thing I wanted to ask you right now, about what age was she about when this happened? She's 46 now.
She was 43.
43 at the time. Okay, so it's about 3 years ago. Okay. So what happened after that?
She moved home, and that was not a good situation. She moved home again, and that was not a good situation. And when I say not a good situation, it's sort of her response to what's going on in the home, and whether or not she wants to eat her meals with the family, whether or not she wants to be involved, whether she feels supported in seeing her and doing the things that, that she wants to do and her interests and that sort of thing. So probably neither of those situations were a good match for her. One of them was a distant relative that the family had felt like would be very, very good for her, but it was sort of the opposite. She expected a lot more out of Jane than she could do. For example, one thing that has been learned since then that she was able to express is you can't tell me more than one thing at a time. So, for example, you ask her to dust the living room. She will very willingly dust the living room, but if you ask her to dust the living room and then after she, to do something, that's going to blow her mind. She just can't do that. And I think because she has so many skills that people understand that she has a process.
Oh yeah, I see this kind of thing. I was just going to say, I see this kind of thing a lot because people will kind of, we have a tendency to give, sometimes it's not just giving more than one thing, it's like giving vague instructions to people that might be understood by a lot of people, but it's more difficult for the person with ID to be able to kind of wrap their mind around what they're being asked to do. And especially, for her, it sounds like when things got added to that, it became overwhelming and difficult for her to plan and figure out how I'm going to do these things in sequence. And so, that is, I think it's often a real big stressor for a lot of the folks that we work with. There is a high frequency of what are called executive functioning problems. So, in other words, I see this a lot in people with Down syndrome, but really with people with ID in general, that if you ask them to do something, it's sort of like they have a hard time creating a cognitive map of how to accomplish that thing. And so, it gets kind of hung up, and you'll sometimes interpret it as resistance, but it's really just a difficulty figuring out how can I get going on this task. And if you have a few of those types of events, the thing that we're talking about called trust starts to erode because you start to have conflict between the staff member and the person. And so I think a lot of times that's very much a circumstance that leads to greater difficulties for someone.
Very well put. And it's only in the current placement that we actually, as a circle, recognize that. Because one day she became very upset over a scenario very much like that, and she went away and thought about it, and she came back and said, "You can't do that to me. You can't tell me more than one thing at a time." And that's when it kind of clicked that, expectations of her have been really high over the years. And I think a lot of times she just shut down rather than being able to say, "I can't think about all these things at one time."
That makes perfect sense. Yeah. And it is true. And I find myself doing this as well. Sometimes I'll get somebody going pretty good, and I'll have a way of interacting with them that builds trust, that is very positive, but then I'll try to bump it up and try to do a little bit more, or get them to do a little bit more than maybe, we've done so far. And then, that starts to erode a little bit over time, and it becomes more overwhelming. The trust breaks down, and you have greater problems as a result of it. So whenever you're going to do that, you really have to kind of think through and also to recognize, kind of going to your point about expectations, that sometimes it's as good as it gets. And there's a place where you just say, okay, this is part of what we do to support this person, is we break these things down into simple steps so that she's able to do them and keep it all in perspective and execute what she's being asked to do. So it sounds like you found that point.
And that is in her plan in pretty good detail at this point. But, I think it took us all, even her grandmother, for that to click.
Yeah, because probably the way she's reacting makes you think she's just being non-compliant.
Yes. Yeah.
And I'm not necessarily besmirching that way of thinking about it, but you have to think about what is the antecedent, what is the thing that is bringing about this resistance to participating. And I think it sounds like you've hit the nail on the head with that.
it seems to be working well for her at this time.
Well, that's good to hear. This, I guess you left off about where she had lost this job. Where has it gone since then?
She, as I said, she had a couple of really, really bad placements. I mean, I know that when I sort of stepped back into the situation, another family model, a younger couple, had expressed interest in working with her, and the agency and even her VA was not in agreement. And so, there was going to be a meeting where they could sit down and actually tell this couple how awful she really was. And I went to that meeting, and I was just in shock, because what they were saying was not the person I had known and experienced for years. It was pretty bad, and the couple did not end up working with her.
So they were the couple that had been working with her came and gave a description.
That were interested in her moving in with them. They had applied to the fund, and the agency did not. They thought they were too young to handle the situation. Other members of the circle thought that that had never really been tried before, and that it would be a very positive thing. At any rate, I ended up going to that meeting and actually sort of having to shut it down because it became so negative personally.
Was she present? Was she present at the meeting?
No.
She wasn't?
No.
Okay. Well, I'm thankful to hear that, because that's...
Please trust me that would not have happened.
I know you well enough to know that. But I did want to take off on that point a little bit, because I do think this is something clinicians, everybody in our system has to think about sometimes. We get very accustomed to talking about people in ways that may actually create a lot of problems for them. And, I think you do have to think in terms of, and I'm not saying people don't need to have feedback on what they're doing, but most people don't like to have that right in front of a whole group of people like that. And so I'm understanding that was not what was done in this circumstance. I'm just using that as a little bit of a sensitivity point for all our listeners out there. Make sure they know that you really do want to avoid doing that. You want to treat the person with disability with respect, pull them aside to talk about things that might be a little bit more difficult to talk about, and do it in a way that's positive. But so it was at least clear here, though, that people had developed a pretty negative attitude toward her.
They're negative, and I mean to the point that in all these years, some of the things they were saying went against everything that I knew about her. At any rate, the couple ended up not. I think the thing that really made them decide not to is the agency had said that she could not be with the man alone at any time in their home, and of course that's not even possible. And so the agency after that actually gave her notice. And when we tried to find another agency, nobody would take her in Clarksville or Nashville that we could find. I think her reputation, true or not true, was preceding her. And so the circle found a home situation with her, with folks that had known her for many years, in a working, more like a working relationship, but neither did they really have that. They did not have this negative attitude of her. moved in with them in November, and I am not kidding when I tell you she has just blossomed. And it isn't that I mean, most of what was said in that meeting we've seen none of. She likes men and she likes to have a relationship, but she finds her own relationship. She doesn't. I mean, this young man, she was not even considered, you know,
Yeah.
him being old enough to be her boyfriend or anything like that. That just wasn't true. And neither did she have many of the personal habits that they said that she had, such as, you know, being incontinent in her room and refusing to bathe and clean it up. The exact opposite has actually proven to be true. She's a very neat and clean person. What we did find out is she does wear Depends, and they had not been ordered for months. And once we were able to order them and then give her the number so that she can call and verify every month, it has absolutely been no problem. She takes care of ordering them. She disposes of it. You would never know that she uses them. So, I mean, that's how off base most of it.
Well, and it
so
is, you know. Go ahead.
When she came into the situation, there was some trust there.
Yeah, because she had known these folks before. Right?
Yeah.
So these were people she already had a positive relationship with and for whom she had trust. I just want to make one point about what you were talking about a moment ago. And, you know, I don't know what those folks were experiencing. Maybe they were experiencing some of those things that you're talking about. But it sounds pretty clear that they had grown to a point that they didn't really care for her very much. And
that's right.
And one of the things Marshall Linehan points out, Marshall Linehan is a person who developed theory around borderline personality disorder. And I'm not diagnosing Jane with borderline personality disorder at this point, although it does sound like she's been in what Marshall Linehan would have called some invalidating environments. And so, when a person experiences trauma like she experienced, that's an invalidating environment. If she's living with people who are mistreating her or not treating her with respect, that's a potential traumatic event for the person. And then, it becomes more and more difficult for them to manage their emotions and this type of thing. But one of the things she says that it's very important for a therapist to like their client. If they don't like their client, they can't really help them. And there's actually research that backs this up, that if you don't like your client, then they're not going to get better. And I think that cuts across any clinical discipline, whether it be behavior analysis, whether it be OTPT, any of the disciplines that where we're providing service, or even just residential care, or being an ISC. Any of these things. If you don't like this person, you're not going to be able to help them. And I would say if that becomes an irrevocable condition that you're in, you've got to discharge that person. You do have to get away from them, and you have to turn it over to somebody who can develop a new and more appropriate relationship with them. But it's very, very important for everybody within the system to be liking the person, or else you're probably going to end up getting more of what you don't like.
100% of my experience tells me that it's 100% true. I've seen that over and over, and relationships for her have broken down pretty badly.
I heard Michelle trying to jump in there. Michelle, did you have something you wanted to add?
Yeah, I tried and failed. No, I just wanted to point out that there was a question in the chat box for a recommendation on how to talk to the circle about sensitive issues. that may not be a comfortable issue to talk about in front of the person when the person's supposed to be involved in all of the meetings. So I think they're looking for recommendations on that.
I'll let Janet speak to that if you want to, and then I can add something. But Janet, do you have a response to that question?
I do, and the way the agency looked at that was that they owed this couple some sort of explanation as to why they were not going to contract with them. And to be honest, I just showed up for that meeting. They did not expect me to be there.
Okay.
And so, then it went into,
It sounds like in this particular case, they were trying to discourage this couple for other reasons. Am I understanding it correctly?
No,
okay.
Dr. Davis. They just thought that it would be a disaster, that she would sexually, I don't know where they got all this information. That somehow, because, and I said at the time, you're not describing the person that I know at all.
Yeah, so going back to the question where we're supposed to have the person involved in discussions about this type of thing, I do think that if you're having to walk on eggshells, that's not a positive thing. I mean, it never works out well if you feel like you can't ever talk about some things that might be difficult. I think, and kind of thinking through this type of situation, first things first, I want to have as much conversation with the person individually as I can without having to cover those things in a public setting like that. And if I am going to have to discuss anything of that nature, that it be real sort of planned as to how that's going to be discussed, and that I've discussed it with the person before we go into that meeting about what all might be brought up and how we're going to deal with all of that. So taking the surprise out of it, I think, is part of it. The other thing about it, and this is, I'm going to just tell you, I have had, it's a huge shift in the way you think about things. Because, we're typically thinking about things like restrictions and all of these things as things that we're imposing on a person. So we're doing things to solve their problem. And what has caused me, I think, over the course of some years here is to turn around, is to start to think about it in terms of trying to give as much responsibility for that concern to the person as I can. And so that's going to vary, obviously, by person that you're dealing with, but the more I can get them involved in the conversation about how to solve the problem, the better they're going to respond. And if I am in a circumstance where I'm just telling somebody all these things you're doing are bad and we're going to have to take some action to try to deal with these things, you're setting up a conflict. But where you engage people in trying to solve a problem and validating what they tell you, and sometimes that's really hard to do because you see this person going down a path that you don't think they ever go down. But ultimately, when you do that, I think it works out better because then things are framed up and things happen and they don't go the way you think they should. You're able to discuss that again with the person and we can come up with a different course of action. But when we're always protecting the person from those outcomes, we find ourselves in a really, really difficult position, I think. And that's why so many of these circumstances go awry and where so many of these meetings become invalidating. We took off in a little bit different direction there, Janice, from what we're talking about. Yeah, go ahead. Sure, please.
I was just going to say, one other thing I would suggest in those situations, too, which Dr. Schuler is always very good about doing during the psychopharmacology reviews, is letting the person know that if the topic makes them uncomfortable or they want us to stop and change the subject at any point, to give them that option, or if they need to take a break. So I think it's good to, if you're going to be discussing issues that may be a problem or a trigger or escalate the person to give them that option on how to appropriately stop the conversation before it gets to the point where they can't come back from it.
Yeah, it's just another kind of aspect of giving the person control over the situation. The more control they have over it, the better that has a tendency to go. Now, I'm not saying that these situations don't become difficult. They do. But, those are a couple things I think you can think about. So, Janice, go ahead and kind of talk us through, is there a conclusion? How is this going now?
Just let me say this. Her grandmother, her legal conservator was in that meeting. And so after the meeting, she and I sat down with Jane and pretty much explained to her what was said, and gave her a chance to give her response. And actually, she did tell me some of it was true, but the other things certainly were not true. Not quite in those, but so she was, because we had to be honest with her, she was looking forward to living with this couple. She had already seen the house, and so basically we told her and then just said that, the agency thought they were too young to live in that situation. And so, she was aware. Well, we basically went to the person she's living with now and begged them to give her a chance, based on pretty much that we did not agree with that assessment. We talked to the executive director of the agency and asked him to give this a chance, and he agreed. And so she moved in with this couple in November. And the first month or two, there was some testing going on, definitely. And basically, they followed the behavior support plan, and little by, not really even little by little, but as the trust that she had to begin with has grown, and not just that, but there's been a lot of honesty. I mean, there were a couple of times that she was told, look, if you're not happy living, this is who we are. This is how we live. If you're not happy with this, let's call your grandmother and go back to the drawing table. Completely honestly, not in any threatening kind of way,
but setting a limit.
Understood that.
And setting a limit and putting it back in her court to say, okay, now how do we deal with this situation? Because, if we continue on this path, it's not going to work. And so you kind of contrast that with, you're doing bad things, I'm going to try to get rid of you. It's a difference in the way that that's communicated, I think, that is very important in those circumstances. And so was that the gist of the behavior plan, was to set those kinds of limits for her under those circumstances? Was there anything else there that was helping or augmenting her response?
It's really much more positive than that. It's pretty much on a daily basis. We validate every time we can. That has to, all of us, everybody in the circle. And it has to be honest validation.
Right.
But, as she takes care of her personal needs and loves things and does chores and that sort of thing, she receives praise. I mean, when she vacuums the living room carpet, it looks really good, and she told it looks good. And also just like somebody said, giving her an out. If she's upset, just withdraw. Give her time to think about it. Usually then the other person sort of steps in and talks to her, so she's not having to there's no confrontation. There's, you know, nobody has to apologize on either side. And she's just responding to that beautifully and has begun to talk about, we've begun to talk to her about what she would like to do in the future. She started going to classes at an agency to, you know, learn how to dress for an interview and how to get and keep a job. She will finish that up the end of August. She's very motivated to go to work because she smokes. And every day she gets goes to cigarettes. So she's motivated to work past that. You know, there's a vacation in the mountains coming up. She's wanting a job to earn money, so she'll, you know, so there's much positive going on. But what we've got, because this couple is older and their goal was not to do, you know, family model services, it's probably not going to last forever. So we've begun to talk to her about what her future in 3 to 5 years is going to look like. And she would very much like to, what she describes as something like semi-independent living would be. She needs people available. She needs, you know, with transportation and that sort of thing. And
is she cognizant of the fact that this couple is not going to be able to continue with her forever? I mean, is that sort of, is she realistic about that?
She is. She does know that. She knew that, you know, sort of from the get-go.
Okay.
This was more like a breathing time to really look at where her future's going. You know, what she wants out of her life. And what she says is she wants her own place. One day she would like to get married. She wants a good job. You know, those sort of things we all want. But she knows she doesn't have to do that right now. That we're talking probably 3 to 5 years. You know, so I don't think there's any feeling that, oh my gosh, something's got to happen right away. She's developing a lot more positive relationship with her current agency. And I think what happened before, she does not hesitate to call people and share. So, you know, it was like daily phone calls and accusations and that. And now I think maybe she's talked to the director one time since November. That's because her spending checks didn't show up when they were supposed to. And so this family has made it, and that was, her money and her cigarettes led to lots and lots of problems. And so they've made a commitment to her that even if the checks are late, the family knows they're coming. She's going to get her money on the 1st and the 15th regardless.
So that's further building that trust.
Yeah, so she's used to, you know, even in this situation, several days before the 1st and the 15th, she would begin to get anxious. And by those dates, she was very anxious that her money was not going to come. She counts her cigarettes out to make sure that she has enough to do hers. And so she just panics if her money's not there. Or she does. So those things have been removed from her, which I probably didn't, but those are very important. And so those are not stressors to her anymore.
Well, this is such a great case. And before we hang up, I want to make sure that I offer anybody out there on the line to come in and ask a question that you may have for Janice. Are there any questions? Anybody want to jump in and ask anything? Well, Janice, I am so happy that you came on today to tell us about this case. This is a very interesting discussion that we've had. I think you emphasized a lot of really important things. First of all, recognizing when a person has had trauma, their need for trust and validation, or what we might call in behavior analysis, we'll call it reinforcement, that people need a lot of reinforcement when they've had those types of experiences before. And, the giving her opportunities to be able to get that, I think, are very, very important in validating her judgments about things, giving her a role in being able to solve the problems that you're dealing with, I think, and then reinforcing and validating those things that she does that move in that direction are very, very important. And so, basically, this looks like a case where you've really taught this gal, she's been able to learn a lot of skills through everything that the circle has done, and by getting into this circumstance that's much more comfortable for her, and that you're already thinking ahead to the next phase, I think, is another key thing, because transitions can often be a thing that makes things difficult. So I really appreciate you coming on and talking to us about this case. Thank you so much.
You're welcome. Thank you all for the opportunity.
And this has been the Clinical Consultation Network. We do this every Tuesday at 1:30 p.m. Central Time, so hope you'll continue to join us every Tuesday for these fascinating discussions. And don't forget about the TNNAD conference on Thursday.